How are you today? Today we're actually going to talk about the endocrine system. Now, the endocrine system is really important to understand. The endocrine system is basically a communication system. As you might recall, the nervous system was one of those systems that we actually talked about, and the nervous system is also a communication system, but the nervous system is more of a electrochemical communication, which means that you actually have chemicals that are involved called neurotransmitters, and you also have the electrical impulses because there's an exchange of the ions. Well, what happens is the endocrine system is completely chemical, nothing else. So, what are the chemicals that are used? They're called hormones. So, when we actually look at it, these hormones are basically most of the time some sort of molecular structure which actually binds to the cell membranes, and then it causes a metabolic change. So, when we actually look at it, one of the things that we also have to look at, why is it that we have these endocrines? Well, the one thing is that we also can compare it to other types of glands. So here we actually have two types of glands. One's an exocrine gland, one's an endocrine gland. Exocrine glands, as we see on the left, actually are having a duct or tube. They produce their product down here. And when we actually look at those products, they actually go up through this duct to a surface. Endocrine glands, on the other hand, they're released by the cell directly into the bloodstream. And the one thing they produce is hormones. Hormones basically will fit into two main categories. Something that's more of a protein-like type structure, and some that are known as a lipid type structure. And that's very important to understand as far as the differences. So you do need to know what the differences are between nervous system and endocrine system as far as communication. You also need to know the differences between exocrine glands and endocrine glands, because that gives us a better insight as far as what's going on. And I want you to realize that the difference of different types of hormones, meaning most of them are like a protein type structure as opposed to a lipid type structure. And the main reason why I mention this is because the hormones that are more of a protein-like structure affect less parts of the body, whereas the lipid type structure can affect more than one part of the body much more readily. So that's important to understand. So when we're actually looking at the hormones, they will actually change things such as metabolism, your biological clock, and your growth, your development, reproduction, and they're in very minute quantities, very minute. So I want you to realize that they're very small. So I want you to also look at this diagram. This diagram actually illustrates real collectively over the entire body, where do we see most of the major endocrine glands? And one of the things that you have to think about is when we look at the endocrine system, it produces, the gland actually produces that hormone. The hormone goes into the blood and it circulates throughout the body until it gets to a target site. That target site is a location where it will actually cause a change in metabolism to that cell. So that's important to also know. When we actually look at endocrine glands, like I said, we have the differences between endocrine and exocrine. So basically, sweat glands and mucoid glands and those are all exocrine, whereas endocrine is everything else. And that's the ones we're really talking about. Now, one of the big things that we don't know about, or you guys may not have heard of, is that there's some localized hormones where they actually affect cells around the surrounding of the cell that produced those hormones. And there are also systemic type hormones where they actually go throughout the whole body. So the majority of the time, we actually look at the systemic type, where it goes throughout the entire body and affects and goes to every part of the body until it reaches that target site. And it's the target site which will actually have that change. So that's important to realize. So here's a representation. Here you will notice that here we actually have an endocrine cell right on the top, and we actually have it producing its hormones. These hormones go into the bloodstream and they circulate around the body. And this is also referred to as circulating hormones. So they actually go to some part of the body where it actually has receptor sites on the target cell, and it affects that specific cell only to change its metabolism. Now, when we actually look at the receptors, this is where we actually see the target site. And I want you to realize that a lot of times we actually can do other things. We can actually, clinically, we can actually produce synthetic hormones that can actually block the effects of the hormones as a medication, or have a representation where we can actually have it produced. Now, like I said, most of the hormones are going to be a protein or a glycoprotein type receptor also. So that's something to realize. When we look at it, most of the time when we regulate hormones, we have to regulate the receptors. And it could be where we can have the synthesize and break down within the range of 2,000 to 100,000 receptors per target cell. So that's a lot of receptors on that one cell. So we can upregulate, we can downregulate. And basically what happens is, if we have excessive amounts of the hormone, it will decrease the receptors and decrease their sensitivity. Whereas upregulation, we will actually have less hormone, and it will increase the number of receptors so that we actually have a more sensitivity to that hormone. And this is important to realize. We can also have blocking the receptors with synthetic medications. For instance, a lot of times you hear about progesterone, and the progesterone levels will maintain a lot of things. But RU486 is actually binding to the receptors, which actually causes inducing abortion, and it also brings on the menstrual cycle, and it also helps to sustain the endometrial layer in a female's uterus. So this is one of those things that we can use as a concept. Circulating and localized hormones are what we also see, like I said earlier. Circulating hormones are what may be more of a systemic type hormone, where we actually have it affecting all parts of the body. And this is the one that we usually think about and we usually talk about. And that's the ones we're going to concentrate mostly on. But we can also have localized hormones. Localized hormones can be things like paracrines. Paracrines actually work on the neighboring cells. Now, one of the big things that we also see is if we actually have a paracrine, for instance, when we actually look at a cell and it's infected by a virus, a lot of times what happens is it may produce things like interleukin. And interleukin is one of those types of hormones for a paracrine type effect. And so what can happen is it will actually inoculate its neighboring cells so that the neighboring cells are then immune to that virus, which is one of the reasons why interleukins were really important to understand. Now, one of the other things we also have is autocrines. Autocrines are where we actually produce the hormone, and the cells that produced it can also get an effect to produce more. One example of this is the testes. So I want you to realize this is a thing that does happen. So representatively, on the top of this diagram is circulating hormones, which we saw earlier. And on the bottom, we see the more localized hormones like the paracrines and the autocrines. So when we're looking at this, we can actually also look at two other things. Like I said earlier, we can have what I refer to as protein-based hormones or lipid-based hormones. Another way of describing them is water-soluble hormones, which would be more the protein-like, and the lipid-soluble, which would be the lipid type. And when we're looking at it, you'll see there's a listing. Steroids are included in lipids, thyroid hormones, nitric oxide are all basically lipid soluble, whereas water soluble are amines, peptides, proteins, glycoproteins, and eicosanoids. So those are useful to understand. Now, one of the things that I want you to realize is that when we actually look at them chemically, the water soluble have less effect on, or have an effect on less cells than lipid soluble. And the lipid soluble, because they are lipid, they may be retained much more readily. The lipid soluble also infiltrates the cell much more easily with less of a mechanism. So that's important to realize when we actually get there. So when we look at some of these hormones, here we actually have some representations. This is a diagram of a aldosterone, which is a steroid. And we also have the thyroid type hormones, which look like that. Nitric oxide is also a gas, which is also a lipid soluble. And you might recall nitric oxide is also the active ingredient that is in Viagra. So water soluble hormones are things that look like these. Okay, so these are amines and such. Some of the examples that you may see are amino acids, serotonin, melatonin, histamine, epinephrine, glucoproteins. We also have eicosanoids, which are what we see here, and examples that are representative of that are prostaglandins and leukotrienes. So those are important to also be aware of. When we look at the hormones, they basically all go into the bloodstream. The protein ones just go freely in the bloodstream, but the steroid ones need to actually have a protein attached to it. So the protein will actually surround it and actually go through the system. When we also look at the mechanism, usually hormones bind to the surface of the target cell. And typically what happens is they then create another messenger. And that messenger actually infiltrates the cell, which then causes a change. So I want you to realize this is something important. And some cells will respond differently if they have the same hormone with the same target. Lipid-soluble hormones bind to the active receptors. And a lot of times the active receptor on lipid-soluble is actually causing the gene expression, which means, remember, I want you to realize when we're actually looking at metabolic changes, basically it falls into what we actually get, which is a protein that causes a change to the characteristics of that cell, which then actually causes the physiological change to the body. Let's look at a diagram like this. Now, if we're looking at this diagram, what do you see? This is what we see as far as a lipid-soluble hormone. Notice it's actually bound to a protein, which is in the blood, which is that blue structure. The hormone is the green structure. And as we're examining it, it goes through the membrane because it doesn't really require too much of a mechanism to get through the membrane. And then it gets into the receptor, which is in the nucleus of the cell. And it causes a change where it actually produces the DNA, which then causes the production of a new protein, causing then the alteration of the metabolism of that cell. Water soluble, on the other hand, they have to bind to the membrane of the cell, and they actually go through a series of things. And they also have that first portion of that receptor in the membrane is the first messenger. And then it gets a second messenger. And that second messenger is what actually causes the change. And a lot of times it actually involves cyclic AMP. So when we're actually looking at it, a lot of times when we have that, it also has activation of what's called G protein. So G protein comes and makes an importance in the cascade of events with this. So if we were to look at that diagram, on the other hand, here we actually have the bloodstream where we have the hormone. It comes out of the bloodstream, binds to the receptor on the surface of the cell. That surface receptor then causes a change where it actually causes the cyclic AMP to be produced. And a lot of times that cyclic AMP will then go and create a second messenger. Okay, so when we're seeing that second messenger, we see in the second diagram where it activates and causes the second messenger to produce the protein. Okay, and a lot of times this also speeds up or slows down the physiological response. Okay, now the second messenger will also involve the cyclic AMP, which means we actually have hormones that do this, are like antidiuretic hormone, thyroid stimulating hormone, acetylcorticotropic hormone, glucagon, or epinephrine. And a lot of times when we look at the hormones, they have a amplification effect. So in other words, one hormone does not just cause a binding and that's it. It may cause the production of 100 G proteins, and those 100 G proteins may produce 1,000 cyclic AMPs, which means it then translates into producing 1,000 molecules, proteins, that then actually have a change to the metabolism. That means that one epinephrine molecule will actually cause a breakdown of about 1,000,000 cells of the proteins. So I want you to realize. So one of the clinical aspects that we should talk about is related to the G proteins. And one of the things that happens is guys might notice that there's actually a bacteria known as cholera, Vibrio cholera. And Vibrio cholera is one of those things that goes around the world. And typically it goes from infected water supply. And how do you get this water supply? Well, it basically, you drink the water, you get exposed to the water from food. And essentially what happens is it translates into causing you to have watery stool or diarrhea. And it's basically this diarrhea that will actually eventually cause you to dehydrate. Well, what happened? Well, the Vibrio cholera creates a toxin which is actually causing this. And the Vibrio cholera, a lot of times it's in areas where they have poor sanitation, and you have contamination of fecal matter into the water supply, and it will actually cause the person to actually dehydrate. Now, one of the problems with this, you get about 70 bowel movements per day. And with that, you deplete electrolytes, so you can't, even with taking in water and even with electrolyte fluids, it would actually be very difficult for the person. So a lot of times you actually have to have antibiotic therapy and also an IV to actually help the person to survive. And some of these locations may not have the medical facilities to do that. So that's one of the reasons it does cause this. When we actually look at the hormones, we actually have three possible effects one hormone can have. We have permissive effects, which means that you get one having the ability to allow another hormone to work. We have synergistic, where they work in concert with each other. And we have antagonistic, where one works against each other. So permissive, we actually have two hormones. The second will strengthen and actually increase the effects of this first. Synergistic, they just affect in concert, where they're not actually causing an increase or decrease. And antagonistic, one works against the other. Typical antagonistic would be insulin and glucagon. So when we actually look at controls, basically what we look at is there's feedback mechanisms. You might remember from chapter 1, there was negative feedback and positive feedback. One of the big problems is that well, negative feedback shuts down the production of whatever it is. Positive produces more. And I want you to realize that when we're looking at most hormone effects, negative feedback, if there is something that goes wrong, negative feedback is less dangerous to the individual Then positive feedback. Think about this. If you actually have an individual and they don't produce insulin because there's a problem with the pancreas, well, what happens is you give them insulin therapy, and that's the extent of it. On the other hand, if we actually have a problem where a person is actually having a tumor associated with their posterior pituitary, and it's causing a problem with antidiuretic hormone, well, they're not producing enough antidiuretic hormone, or shall I say, they produce the antidiuretic hormone, and they keep producing it, and they keep producing it, and they keep producing it, and if they're not getting the effect that is trying to identify, well, they're going to keep producing it, and it's going to cause them to dehydrate. So I want you to realize that these effects are real, and they do affect the body. So here's one of the things that we should look at. One of the things I want you to do on paper is create a table. The table will actually show you placing in the first column the gland, second column the hormone, third column what is the effect, what is the target organ, and what is the effect. So when we're looking at it, you're going to notice that you're going to see the hypothalamus and the pituitary tied together. And if we look at the hypothalamus, a lot of times, even though it affects the pituitary, both the anterior and the posterior, you'll notice that they're having different effects. So one of the things that we see, the anterior pituitary and the posterior pituitary will actually produce different hormones. And the hypothalamus will cause the release of hypothalamic releasing hormones. So it affects your homeostasis, your metabolism, your growth, and a variety of other factors. Now, one of the things that we also should say is that it's also affected by your emotions from your limbic system. So I want you to realize this actually does have a variety of effects. When we look at the pituitary gland, it's about the size of a pea. If you guys remember from when you looked at the skeletal system, it was actually, the pituitary gland was actually located in your sphenoid bone at the sella turcica. Now, one thing that you'll notice is that the anterior pituitary and the posterior pituitary have different controls. The anterior pituitary is hormonal control, which means that you have the releasing hormones that then go down into the anterior pituitary, release it, and then produce the hormones of the anterior pituitary. The posterior pituitary, on the other hand, you actually have neurons. The cell body and the dendrite are in the hypothalamus, but the axon extends into the posterior pituitary, where it releases its hormone, which is then the actual the hormone that we're actually going to see is from the posterior pituitary. This is one of the reasons that you'll notice the names anterior pituitary and posterior pituitary are also known as anterior pituitary, also the adrenal hypophysis, and the posterior pituitary being referred to as the neural hypophysis. And what I want you to think about is the anterior pituitary has about 75% of the pituitary, and posterior is 25%. So when we're looking at it, the anterior pituitary, one of the things that we would see is because it actually is larger, it produces more of the hormones. An anterior pituitary, one of the things it does is it actually has an effect on more parts of the body, including other endocrine glands of the body. And so that's one of the reasons we would actually say the anterior pituitary is referred to a lot of times as the master gland, because it actually controls so much, even though you would think the hypothalamus would be. But it's the anterior pituitary, which is known as the master gland. So when we're actually examining it, you actually have some groupings. So we have human growth hormone, which is known as HGH or just GH. And it will actually affect somatotrophs, which are basically muscles. You have thyroid stimulating hormone, TSH, which affects the thyroid. You have follicle stimulating hormone, which will affect the follicles in the gonads, which are the reproductive organs. You'll see the luteinizing hormone, which is going to affect gonadotropes, which is basically affecting also in the reproductive organs, but it's actually affecting the hormone production in those glands. You'll also notice prolactin, which is actually known as PRL, which is actually causing the production of milk in the mammary glands. You'll notice that we also have the adrenocorticotropic hormones, ACTH, which actually affects the adrenal cortex. And we also have the melanocyte stimulating hormone, MSH, which has an effect on changing it actually has an effect on skin tone. I want you to realize that to some extent. How? We're not sure. Why? Okay? So if we were to look at this picture, what do you see? You see the pituitary gland. And what do we actually see? It actually has the two parts, so that we have the two parts right there. Now, the anterior pituitary, well, it does have blood flow. And here's the different glandular cells that are affected. Do you need to know these names? No, but it's important to understand what the different groupings are so you have a better concept of what their hormones will be. So when we actually look at it, a lot of the anterior pituitary works on a negative feedback mechanism. Most hormones and most glands of the body work on the negative feedback mechanism. So I want you to realize that. When we also look at it, this is a picture of the negative feedback mechanism, just to give you an idea. So when we're looking at the positive feedback mechanism, the posterior pituitary has a positive feedback mechanism. So what do we actually see in the posterior pituitary? We have the production of oxytocin, and this will actually, and also antidiuretic hormone. But oxytocin is another example where we can see it. If we actually look at oxytocin, you have if you actually were to look at it, it's stimulated by a couple factors. And one of those factors could be some sort of irritant inside the uterus. So if you actually looked at it on females, typically, if they're actually having their monthly menstrual occurrences and the sloughing off the endometrial layer of the uterus, well, that's causing an irritation. That irritation is then causing them to stimulate the production of oxytocin, and the oxytocin is then going to cause uterine contractions. Simple idea. Okay, so if on the situation that they are going through labor, that irritant is then the fetus that's ready to get born. And so it's producing natural oxytocin to actually cause contractions, to cause the amount of the contractions and the duration of it to build up so that the labor can continue. Well, here's the thing. Sometimes individuals will actually have problems with the endometrial layer of their uterus, and they may have endometriosis or they have myometriosis, and that would also be an irritant. So that's one of the reasons why you might notice that some individuals may notice strong uterine contractions which cause pain and discomfort, or cramps that are more severe. So this is all related to the oxytocin, and it doesn't go away until whatever was causing that irritation is gone. So like we saw with having a baby, once the baby is born, the baby is no longer inside the uterus to actually cause that irritation. When we look at growth hormone, one of the things that we see, it does require energy. So what happens is this can also affect the usage of sugars. So you can actually have excessive amounts of human growth hormone, which will cause the person to grow, and it may actually require more usage of sugars, which will cause hyperglycemia. Now, one of the things that you notice is that I'm going to mention, when we actually have hormonal problems, we can have overproduction or underproduction. Overproduction is hyper, underproduction is hypo. And one of the things that happens is it gives, when we have excessive amounts of human growth hormone, it can actually cause insulin-like growth factors that are causing a problem with it. So I want you to realize that that does affect people. And what we can see is this can actually affect people by actually causing them to have, let's say if we have excessive amounts, we can actually have giantism, which causes the person to grow big. Or we can actually have, if we have hypoproduction, we can have what's called dwarfism, which causes them to grow very short. And here's an example. You might notice that some of you might remember a wrestler who was named Andre the Giant. He also did some movies. Well, he was about 7 feet tall. He was a big guy. Well, what happened was he passed away. Why? Because his usage of growth caused him to also get insulin-like problems, which meant he had a diabetic type occurrence. So it caused, those types of problems. And it does happen. Now, what we also see is acromegalia, which is basically where we produce a more grotesque appearance, which means we actually have growth of the knuckles, and we have like the brow can actually have a more growth there, which looks more like what we actually usually think of a Cro-Magnon type individual. So you might notice that also, especially in adulthood. So it's very important to understand that that it does affect us even in adulthood. So, and we can regulate it by basically feedback mechanisms. So that's all that's showing. And so we have diabetogenic effects from growth hormone, which means it causes what's called beta cell burnout. Beta cells are the cells in the pancreas that produce insulin. So it does cause an effect that's like diabetes mellitus eventually. Second hormone, thyroid stimulating hormone. Well, what does this do? It goes to the thyroid and stimulates the thyroid gland. Well, at the thyroid gland, we actually produce a couple hormones, T3 and T4, which is basically triiodothyronine and thyroxine. These are the hormones that then cause metabolic rate to occur. So if you have a high metabolic rate, chances are you're thinner and you burn off energy from your nutrients much more readily than if you have a slow metabolic rate. And it's basically a thyroid stimulating hormone, which then is actually affecting the thyroid with these hormones. So this is important to realize. Think about this. If you have a high metabolic rate, you can actually have a whole, let's say, a whole Thanksgiving dinner, and you might lose 5 pounds. Whereas somebody which has a slow metabolic rate, they may look at a photograph of some food in a magazine and gain 15 pounds. Okay, that was my joke, about it. But you understand the concept of the differences. I want you to realize that. Follicle stimulating hormone. Like I said, follicle stimulating hormone will actually go to the gonads and produce the follicle, which is basically either, if it's a female, the follicle, which then produces the egg cell. Or if in the male, it produces the sperm cells in the testes. Luteinizing hormone. This also goes to the gonads, but in the female, it actually causes the production of estrogen and progesterone. Whereas in the male, it actually stimulates to produce more of the testosterone to create that hormone. Prolactin. Prolactin goes to the mammary glands to produce milk production. And basically, this is actually stimulated by suckling of an infant on the mammary glands. Adrenocorticotropic hormone, ACTH, goes to the adrenal cortex, and it actually causes the release of glucocorticoids. And we'll talk about them when we get to the adrenal cortex. We also have melanocyte stimulating hormone. This does cause an increase in the skin pigmentation. We're not sure what it really does in humans exactly, but we know it does that. So we now get to the posterior pituitary. Now, one of the things I want you to realize, you actually showed on your chart, if you made up your chart, all these different hormones for that one gland, but you also need to know their abbreviation. So you realize if you see the abbreviation, what it indicates. Now, posterior pituitary, we have basically two hormones, oxytocin and antidiuretic hormone. That's it. They're neurohypothesis, which means they are basically the release products of the axon that is actually coming from the hypothalamus down to the posterior pituitary to release it, and it goes into the bloodstream also. Okay, so it goes that way. And here's an image of showing what the posterior pituitary is, and you'll notice here are the cell bodies of those neurons, and they extend down into the posterior pituitary where they release those two hormones. The oxytocin in particular, like I said, basically what it does is it causes, it's affected by the uterus. It's also affected by the nursing of a baby. So what we actually see is this. Basically what happens is oxytocin is what actually causes the uterus to actually contract and to actually stretch the cervix and things like that, but it also is useful as far as letting the milk down, which means the suckling allows the milk to be released. So notice if you've ever had children, that the baby crying will actually cause you to actually release milk. So this is one of those things that happens. And we talked about how this mechanism works, that it continues. And there are individuals that could actually have problems with the hormones, just so you know. And so it does happen. Antidiuretic hormone we talked about when we talked about the urinary system, but it basically has an effect on the decreasing the urine volume. So it will actually get affected by the sodium levels, or it affects sodium, which then affects the water. So antidiuretic hormone will decrease urine production and decrease sweating and increase blood pressure. Because if you increase the amount of fluid being reabsorbed, it will increase the volume of the blood, which will then increase the blood pressure. One of the other things is antidiuretic hormone is known as vasopressin. And we actually, like we said, it's a positive feedback mechanism. So it does actually have problems. The thyroid gland. Let's talk about the thyroid gland now. Now, the thyroid gland, you'll notice, is right around our throat. And one of the things that we see is it produces triiodothyronine, thyroxine. It also produces calcitonin. But when we actually look at it, the thyroxine and the triiodothyronine, one of the reasons they're called T3 and T4 is because they actually are changes, and they actually also utilize iodine to produce those hormones. Calcitonin, on the other hand, will affect calcium levels in the blood. So if we actually were to look at the thyroid gland, this is where we find it around the trachea. It's about 1 ounce in weight, and It's not that big. Now, on the back of it, though, you'll have some nodules, which are really what we call the parathyroid hormone, or parathyroid gland, which produces parathyroid hormone, which has an antagonistic effect of the hormones of the thyroid gland. So when we're looking at it, histologically, this is what the cells look like. You'll notice that on this, we actually see a follicle, and the cells around the follicle are the ones that produce the hormones, and the follicle will actually contain the production. When we also look at it, iodine is necessary for this. So that's one of the things that's really important. And we actually go from T1 to T2 before we actually get T3 and T4. This diagram actually shows the mechanism of going through each stage. So I want you to at least see it so you have an understanding. That means as we're going through this mechanism, iodine actually is important. So if we don't have the iodine, we're not going to have normal production of the hormones, the T3 and the T4, or triiodothyronine and thyroxine, which affects the metabolic rate. So when we're looking at it, here's another representation of, here we actually have the follicular cells, which are producing the T3 and T4. The parafollicular cells, which are outside of that, is where we see the calcitonin being produced. Now, what happens? Calcitonin is the one that's the more antagonistic of the parathyroid hormone, and that's responsible for affecting the bones. Okay, so basically, it lowers blood calcium levels. So we actually see that the bones can actually build up on their own when this is more prevalent. When we look at it, here's an effect of the negative feedback mechanism that the T3 and T4 have on the metabolism. And one of the things that we see that typically, because iodine is necessary to produce T3 and T4, basically what happens is T3 and T4, if we don't have enough iodine in our diet, we actually get something called a simple goiter. Now, how can we avoid that? Well, we eat something from the ocean. So that means seafood. Not like my diet, seafood diet, you know. But if we actually were to look at this is one of the reasons that you'll notice in stores that there are, when you go to buy salt, a lot of times you see iodized salt because some parts of the world are landlocked. So they don't have access to, historically in the past, to ocean fish or ocean food. So they didn't have the exposure of the iodine, and they would have more of a problem with goiters. And how can you correct it? Eat seafood. Parathyroid hormone is actually much smaller. They actually have principal cells that produce the hormone, and they're to the posterior portion of the where the thyroid is, and they will actually cause an increase to the calcium and magnesium levels in the blood. Now, how do they do that? They actually cause a stimulation to the osteoclast cells, which then breaks down the mineral deposits in the bone, which then causes an increase in blood calcium levels. Simple. But it also affects the kidneys and the also the absorption of calcium in the diet. So if we were to look at it over here, we see nodules that are the parathyroid. They're only about, they look like peas. That's it. They're very tiny. Blood calcium, like I said, this is an antagonistic effect between the calcitonin and the parathyroid hormone. So this that this diagram actually tries to illustrate that. We get our next gland, the adrenal glands. Now, there are two parts of the adrenal glands also. We have the adrenal cortex and we have the adrenal medulla. Now, here's one of the big things. The adrenal cortex will have 3 different types of hormones produced. They are under hormonal control from the anterior pituitary. But the adrenal medulla is under nerve control, which actually causes the release of epinephrine and norepinephrine. So that's important to also realize that there's 2 parts and they're from different controls. The adrenal cortex will have three zones, and they produce 3 different types of hormones. We have the mineralocorticoids, that's important, the glucocorticoids, that's important, and the adrenal androgens, that's important, or what can also be referred to as the adrenal corticotropic hormones. That's another way of saying it. Okay, so basically the androgens are essentially reproductive hormones, but they will be the opposite of the gender. So basically, if you actually have a female, she's producing estrogen and progesterone in her ovaries, but at the adrenal cortex, she's producing androgens, which is basically very similar, a type of testosterone type hormone. So androgens, testosterone is part of them. So what happens is it creates secondary sex characteristics of a male, whereas her gonad will produce female secondary sex characteristics. So that's important to also remember. When we look at it histologically, this is what the adrenal gland looks like. Do I want you to remember the actual zones? No. But to get a representation so you understand, that sometimes helps you to realize what's going on. So the mineralocorticoids, 95% of them is aldosterone. Aldosterone will affect sodium reabsorption, calcium reabsorption, potassium excretion. And so what happens is when we have a tumor, it can produce hypersecretions of this, which will then cause an increase to the water retention, which from the sodium levels that are increased, and therefore cause high blood pressure. And this chart basically shows how we actually regulate aldosterone, because you might remember the kidneys have a direct effect on it. The glucocorticoids, 95% of it is cortisol. Now, some of you guys might remember that if you go to the store, you might notice something called hydrocortisone. That's a comparable product to cortisol. Well, cortisol is one of those products that actually decreases inflammation. How does it cause a decrease in inflammation? Is basically, as it's describing here, it's causing conversions and stimulating lipolysis and things like this. So basically, it actually has an effect of having an effect of basically causing the person to no longer have a problem. Now, here's the thing. This is the hormone, aldosterone or cortisol. This is the hormone which is decreasing inflammation. Hydrocortisone, which is the topical agent, will actually have a buildup of the amount in the body. But this one is important to decreasing stress on the body, in other words, which is the reason if there is a tumor in the adrenal gland, you can live without the adrenal medulla, but not the adrenal cortex. and that's important to know. But because the adrenal medulla produces the norepinephrine and epinephrine, which actually causes you more of that stressed scenario, like the fight or flight that we talked about in the nervous system. And we have a negative feedback on it. And the third area of the adrenal cortex is where we produce the androgens. And here's the thing. If you guys remember, secondary sex characteristics of males would be facial hair. This is one of the things that you would notice if you actually had years ago when you looked at circuses. Circuses could have the bearded lady of the circus. Well, in all reality, she had probably a problem with her adrenal cortex, which produced excessive amounts of this hormone that gave her a beard and a mustache that was more pronounced. So that's one of the reasons. And that's one of the reasons that you'll also notice a secondary sex characteristic of the androgens is also aggressive behavior, which is why you'll actually notice after menopause, a lot of females may also have an increase in their sex drive. The adrenal medulla, on the other hand, will produce, like I said, epinephrine and norepinephrine, which actually has the same effects as the sympathetic nervous system, the fight or flight, the more stress type scenario. So, next hormone or gland is the pancreas. Now, the pancreas is interesting because it has both endocrine and exocrine functions. The exocrine functions we've already talked about with the digestive system. But the endocrine function is in what's called the pancreatic islets or the islets of Langerhans. These islets of Langerhans, one of the things that we see is that they have different cells that produce different hormones. Now, one of the hormones that they produce is, of course, when we look at it, is the insulin. Now, if you're looking at it, the pancreas is only 5 inches long, but 99% of it is actually producing the digestive exocrine enzymes. The endocrine function, which is what we see over here, is our different cells. And then they're very tiny, and they produce alpha cells, beta cells, and also gamma cells. So the alpha cells will actually produce glucagon, the beta cells will produce insulin, and the delta cells will produce somatostatins. The ones that you need to really think about are the alpha cells and the beta cells with the glucagon and the insulin. You'll notice that in recent times that somatostatins have also been looked at clinically. So I want you to understand that may be useful for your understanding. But insulin decreases blood sugar levels. Glucagon increases blood sugar levels. You eat, you use insulin to break it down and go to the liver to actually have it convert the sugar into glycogen, and also causing the cells to take up more of that sugar. On the other hand, the glucagon breaks down the glycogen in the liver so that you can actually have more sugar available in the bloodstream at that time. So it has a very interesting control system. So the ovaries and testes, ovaries produce estrogen and progesterone. Don't worry about the others. Testes produce testosterone. And any of these hormones produce secondary sex characteristics, which we'll discuss more when we get to the reproductive system. So I want you to realize that we will talk about that. Pineal gland. Pineal gland is a very tiny gland. It's very small. It actually produces melatonin, which actually establishes our biological clock. This affects us with jet lag and seasonal um, problems with light, and it also maintains us how we actually that we wake up and we go to sleep about the same time every day. So when we're actually looking at it, light does have a direct effect on it. That's why you'll actually notice if you ever travel in recent years, some of the planes, they actually change the lighting inside to try to get you to readjust to the light and have less of an issue with jet lag. So this is one of those things that happens. You'll also notice that seasonal affective disorder, which is what we see in December a lot of times, where there's less light in the year than we see at other times of the year, that it does cause depression. And a lot of times, light therapy actually is used for patients that need this, which is why, like I said, in planes, they actually are adjusting the light inside to actually get passengers to readjust much more readily and not have the effects of jet lag as readily. Now, the thymus gland is also important. The thymus gland is on top of our heart. It actually shrinks over time. So one of the things that happens is you actually will notice that it's larger now than it is next year. And it was largest when we were a newborn. And one of the things it does is it produces our T cells, our T lymphocytes. So that's the only thing I'm going to mention about them. We do also have some other hormones. We have echinocenoids, which basically have an effect on local areas, like leukotrienes and prostaglandins. Now, leukotrienes will influence inflammation. Prostaglandins will also affect what's going on with our blood and having inflammation. So one of the things that happens is aspirin and other non-steroidal anti-inflammatory drugs, such as ibuprofen and acetaminophen, will also have an effect on prostaglandins. So it's important to realize that's why we can use aspirin and others as anti-inflammatories. But they have a different effect. Aspirin was discovered in the 1800s, and basically ibuprofen was identified in 1971. And we looked at it to try to identify. So that's one of the reasons we can use these medications for rheumatoid arthritis and other inflammatory disorders. But that's why we also use it to reduce pain and fever. Okay. Hold on. What's going on? Okay, so prostaglandins, they do actually have a usefulness to us as far as the endocrine system. Growth factors. One of the things that you'll notice, growth factors are basically, most of the time, growth factors of different types. They have different names. That depends on what is being grown at that time. So those are all related. So you don't have to worry about the details of them. Stress. Stressors will also play a role as far as heat, cold, surgical, poisons, infections, fever, emotions. These are all factors that affect you as far as stress. And they can actually cause you to have basically symptoms that may represent things that are common, and we're going to talk about them real quickly. So when we look at stress, we also get general adaptation syndrome, which basically causes us to have these emergency type of related symptoms. And stress can be of, whatever is going on, whatever is a challenge, physically, psychologically, emotionally. These can actually have an effect on you. And here's a chart that actually gives you an indication of what can happen, but it's not just happening to you, it's also going to affect your organs and how your organs actually affect your body. Now think about this. Most of the time when you were growing up, your mother said, put your coat on in the winter. Close your coat because you'll catch a cold. And you guys know that typically you don't get a cold from just having basically having your coat open. You have to have that organism, that microbe, that virus that you came in contact with. But having the stressors of temperature and other things can actually bring on the syndrome, which will then cause you having more of a susceptibility to actually coming down with the symptoms of that infection. So when we're looking at it also, we can also get our alarm reaction, which is our fight or flight reaction, which we talked about. So you get attacked by a dog, you increase your blood supply, all this. Well, what also happens is you also have non-essential bodily functions inhibited. You don't digest, you don't urinate, and you don't reproduce at that time, basically. We have resistance reactions that happen too. So when we're looking at it, when we're having long-term reactions to stress, it can affect our various hormones. And the result of it will actually cause us to actually allow our body to try to fight that stressor. But after a while, if we don't have enough glucocorticoids produced to reduce that stress, what happens is it affects us physiologically. And we then come down with symptoms. This is one of the reasons that if you actually have some sort of emotional stressor, it can still bring on stressors that give you symptoms like a cold. So exhaustion can also cause you to have a depletion of your glucocorticoids, which will also have an effect on your body. And overall, all this stress then can have, if you actually look at it, can have a collective effect to cause you to have your body coming down with symptoms. And it is why you actually will notice that your immune system will be more susceptible to actually picking up something or allowing that thing to actually cause your body to come down with secondary problems. So if we actually are noticing at this point in time, people that actually have chronic illnesses, problems with their immune system, can actually have effects that will affect them with this virus that we're dealing with in the world today. And it's these secondary infections or secondary problems that can actually cause more of a problem overall, which is why some individuals are more susceptible to actually succumbing to death because of these other stressors. When we look at it, our endocrine system develops from basically a couple of things in our ectoderm. So that's all I want, and some of it from our endoderm. So that's all I want you to realize about it. But visually, this is what it looks like. Don't worry about the image. Just look at it to try to get a concept so you understand it better. And here's more images. But when we develop, we actually produce our glands, and that's all I want you to realize. But aging plays a role. Our muscles atrophy. Our metabolic rate decreases. We get more accumulation of fat, and our systems start to actually reduce production. And so therefore what happens is we actually no longer produce the same hormones that we used to when we were younger. So as we age, everything slows down. A couple problems. We have diabetes insipidus, which is basically where the posterior pituitary is not functioning, so we don't produce enough antidiuretic hormones, so we actually urinate a lot. And we thirst a lot because we now are losing so much water. We also have giantism, pituitary dwarfism. We talked about that earlier in this presentation. We also talked about acromegaly. Thyroid problems such as hypothyroidism and hyperthyroidism. Well, hypothyroidism will actually cause you to get more weight developing, will change your body temperature, and will create you to become, unfortunately, mentally dull. So you may not be as sharp as you should be. But we also notice that it also can lead to some sort of cretinism. Okay, so I want you to realize that that does happen too. We also have one of the hyperthyroidisms is Graves' disease, and that will cause weight loss, nervousness, tremors. And one of the things that we also see is exophthalmos. And this is actually where you see the eyes bulging. And what happens is, you might recall, years ago, there was a president in the White House. His name was Bush. His wife was Barbara Bush. She actually had Graves' disease. Well, because of the national security of the presidency, President Bush, not George W., but George, he developed Graves' disease from the testing. Because how did they test it? They tested by radioactive isotopes of iodine, and it caused him to develop Graves' disease. So what do they do as treatment? They give radioactive isotopes of iodine to kill off the cells. You can also get goiters. Like I said, simple goiter is basically because you didn't ingest enough iodine. So that does happen. Parathyroid can actually cause basically muscle tremors. Okay. The adrenal glands, if we have a problem with that, a tumor, that will cause problems with the hormones, like the fight or flight response in the medulla. If you have too much production, you can cause Cushing's disease, which is a hypersecretion of glucocorticoids, which cause thin legs and arms, bruising easily. Addison's disease, where we actually have hypersecretion of glucocorticoids, where it causes muscle weakness, low blood pressure, and it can also cause potential of cardiac arrest. Pancreatic problems. Pancreatic problems are diabetes mellitus, type 1, type 2, also gestational. Gestational is during child pregnancy, Diabetes type 1 is insulin dependent, which usually was called juvenile diabetes, which means the person does not produce insulin, so they're on insulin therapy. Type 2 is known as insulin independent, which means they're regulated by diet and other means. So what happens is that was historically referred to as adult onset diabetes. Does it mean that? No. You can develop either type at any time during your life if you're going to develop diabetes. But both of those will actually produce excess urinating, excess eating, excess thirst because you're urinating so much. And the regulation of this is really concerning, because a lot of times diabetes and mellitus has poor circulation, And so that's where we see individuals where they have amputations. That's where they have eye problems. That's why we look at their feet and other things. So it does happen. If we produce too much insulin, hyperinsulinism, this will cause hypoglycemia, where the person will actually have too much or too little sugar, and it can actually also cause problems. So we also can look at the different review areas just to get an idea. So that's all I'm doing, is going through this part for you so you see it. And that way you also can understand. Now, don't worry. If you miss something, you can always go back in it to look at the video. And, well, that's about it for now. Have a good day.